Connecticut Senator Richard Blumenthal, now among Democrats raising concerns about the well-being of our sailors aboard the USS Abraham Lincoln. That lawmaker sending a letter to Defense Secretary Hegseth and the Navy's acting secretary requesting that they answer questions on whether the Navy is able to properly care for service members. It comes amid reports that the sailors are exhausted and being pushed to the brink. The Military Times also reporting at least one family is alleging a sailor attempted to go overboard on the Abe Lincoln. Responding to those reports, the Navy says we have not identified an increase in reported suicidal ideation or suicide attempts aboard the ship. Let's bring in our senior Pentagon reporter, Luis Martinez, for more. It's interesting just the verbiage in that quote. We have not identified an increase in reported suicidal ideation or suicide attempts aboard the ship. They didn't completely deny or confirm. It's interesting the words that they choose to use. So let's talk about the demands and what we're hearing, from the Navy at this point. What the sailors are saying, what the Military Times is reporting, and how this is really pushing this story forward.
Well, Kara, we should point out that this suicidal ideation is something that actually happens across the entire military force, not just aboard ships at sea. When we talked to a U.S. official, they pointed that it is not uncommon for sailors to be aboard a ship that, yes, there will be some reports of suicidal ideation, either comments that they've made or comments that are overheard by others, or that they self-report, or maybe even attempts at suicidal ideation. But typically what happens is that we see these reports happen towards the start of a deployment. And what we are hearing from a U.S. official is that over the last 9 months, the numbers actually have gone down, and that it is they don't corroborate what has been implied in some reports, that the longer that this deployment has taken place, that there's been an increase with regards to suicidal ideation. I spoke with another official who did confirm that, yes, there was one sailor who was reported overboard last month and was quickly recovered at sea. But that incident is under investigation right now to determine intent. We also have learned from that official that re-enlistment, which would be an indicator of morale aboard the ship, is up in recent months, which would kind of be at odds with the notion that the longer that the ship is at sea, that morale is going to be impacted. But I guess we should point out again, this ship was diverted to the Middle East. It did not make a port of call in between for more than 210 days. That is a long length of time. And so, yes, there's going to be concerns when you're dealing day in and day out with the same kind of operations. I know you've seen it firsthand being aboard an aircraft carrier. That can be really intense in a time of war.
Yeah, no, and that's a really good point. And I think that a lot has changed. I was on the Abraham Lincoln during Operation Iraqi Freedom. And, over 20 years, there have been a lot of changes with regard to mental health. We've reported on everything from PTS to suicide to all the challenges the military deals with. And we know now that there are people on these ships, mental health folks and resources and even chaplains. And so, it's, I guess, moving forward, and we are going to have, by the way, the editor-in-chief of the Military Times on in the next hour. Do you think, through your sources, and also, you cover the Pentagon, you've been doing this a very long time, do you think this story will help sailors and even other service members when it comes to mental health? Do you think this story is finally broken? Will it do something? Do you get a sense that now members of the military will be proactive in trying to help all our men and women that are having a tough time when you're out at sea for long periods of time, not knowing when you're going to be home?
Especially when it's unexpected, right, Kara? And you're right. Over the last 20 years, what we've seen is an incredible focus by the U.S. military in trying to enhance and improve access to military care, because the realization came, unfortunately, at some cost, that a mentally healthy soldier, service member, is going to be very productive for the force as a whole, and that you're going to have to deal with these tough issues when they pop up. And so, yes, what we have seen is growing access over to especially aboard ships, to some of the mental health professionals, or as you said, even to chaplains that can be there to provide mental or moral support for somebody who's experiencing difficulties. One of the things that we've always heard is that the more that people talk about it, the easier it is. You want to break down the stigma of accessing mental health care, the stigma of recognizing that you may have some issues that are impacting you professionally as well as personally. And so, yes, as we see stories like this come out, I think one of the things that you see when you talk to military professionals who deal with mental health is that awareness raises awareness about bringing down stigmas and any potential seeking access to any kind of care.
Yeah, there's a lot of young kids on those ships, and they don't realize what they're necessarily coming into, and that the resources just have to be there for everyone, all men, all women, all ages, because there's a lot of pressure on our military as they serve our country in these times. Louis, thank you so much. Always appreciate your reporting, and it's definitely a story we'll stay on top of.
Thanks, Karen.
All right. And if you or someone you know is in a mental health crisis, text or call the Suicide and Crisis Lifeline at 988. Help is available 24/7.